Hi, I'm Rosie Yates. I'm a psychology doctoral candidate in my final year of study at Monash University, and I've been doing my research with the Victorian Infant Brain Studies Group, or VIBES Group, who operate out of MCRI as part of the Centre for Research Excellence in Newborn Medicine. We recently published findings in the journal called Pediatrics, looking at the mental health of a group of children who were born very preterm, in this case less than 30 weeks of gestation, as well as a separate group of children born full term around the same time. All of these children had just turned 13 years old, and the same group had also been observed at 7 years of age. So what we were interested in knowing was if their mental health was looking any different at age 13 from how it had been at age 7. What we found was that children born very preterm were more likely to meet criteria for a mental health condition at age 13 than those born full term. Anxiety was the most commonly occurring disorder across both groups, and we do know that a lot of young people struggle with anxiety. But in terms of differences between groups, attention deficit hyperactivity disorder, or ADHD, had the highest differential risk, and that means that the children born very preterm were around 5 times more likely to experience ADHD than the children born term. So that was around 10% compared with around 2%. However, something new that we found was the way that mental health had actually changed for these children between 7 and 13 years of age. So even though overall rates were about the same, it wasn't always the same children that we saw meeting criteria for a mental health condition at each time point. What we did see was that some conditions like separation anxiety and phobias became less common as the children grew older, whilst others might emerge in different children, things like generalised anxiety around age 13, which we know is a sensitive age for things like high school transitions, beginning puberty, that sort of thing. So these findings tell us a couple of things. Firstly, that children born very preterm are more vulnerable to the development of mental health conditions. So we really need to make sure we are monitoring them and encouraging support for them and their families if they do need that. The second thing though is to be careful with assigning diagnostic labels, just because those can change for individual kids over time. The most important thing overall is that they can access the interventions they need to support their mental health.